Welcome to Tess Talk, where we discuss issues that are important to our community. And today is going to be a little different. I'm Dr. Tess, and I'm asking the questions of Jalisa, our usual moderator, because she is an expert in insurance. Now, when they first suggested that we talk about insurance, my first response was insurance is evil. But we're going to ask Jalisa to tell us about it. We're talking health insurance here. Life insurance is okay. Health insurance is an issue. So Jalisa, tell us about your experience working with insurance.
Yeah, so I've been a licensed health insurance agent for 10 years, specializing with Medicare insurance as well as Affordable Care Act. So I've been able to assist clients on, shopping around to find the most affordable, healthcare that's available. And that's the gist of what I've done for 10 years.
So what was it that made you decide you wanted to find a job with Garcia Family Medicine?
So the first time that I spoke with Gigi, and she was explaining direct primary care, I was actually just blown away because I had never heard of it, number one. But number two, just my thought process, the way we are conditioned just in general about the traditional healthcare system and what that entails, I saw a value right away. And I understood that with the healthcare system, not necessarily that I was failing, people, but the healthcare system in general is really failing families. And again, no one really has the knowledge or the education of what direct primary care is to even have that option. So again, just speaking with her and her explaining that model, and then doing my research and seeing the new innovative way to offer healthcare, different healthcare options to people. And again, it's just bringing that value back to people in general.
So in explanation, direct primary care is a form of medicine that operates outside of the insurance system. We don't take insurance, and we are able to do that because we provide medical care at such a low price that people are able to get the care of a family doctor who is their primary care specialist without having insurance. So I'm certain you can see why direct primary care would be of value to the uninsured. But could you explain to our insured audience why direct primary care would be just as valuable to them?
Yeah, of course. Number one, you're not having to meet a max out of pocket. So that's going to be calculating all co-pays, all co-insurance and deductibles on your plan. So I always tell people, what is the amount that you have to pay before your plan actually starts to pay? So they'll look at their deductible, and it could be $3,000, it can be $7,000. So number one, you're automatically saving on your medical out-of-pocket costs. Again, it could be thousands of dollars, versus with direct primary care, you don't have to meet that deductible. I have a lot of clients that had to go see not just their primary doctor, but specialists, and they had to pay, it could be $20, it could be $70 copay every single time that they had to go. And with direct primary care, you don't have to do that because it's automatically going to be included with your membership when you pay for your subscription. With the insurance as well, you have to have services that are within the summary of benefits that have to be covered. So if something's not covered, the patient that needs that, they have to pay that out of pocket as well. And then of course they have to make sure your providers are in network. So it's just really limited on what they can receive or can afford. And with direct primary care, you don't have to, think about your value of life based off of what you can afford. So those are going to be the major differences that I see. Really, again, it's just about the education so that they understand what it all entails.
Okay, now, in direct primary care, I mean, you're paying that membership, and that's covering seeing me. Well, what about things like when they have blood work that needs to be run, or x-rays that need to be gotten? What do you know about how direct primary care helps in that?
Yeah, so it definitely lowers the cost. So with that membership, they do get those discounted costs for blood work and labs, things like that, versus the health insurance, they're paying per service. So they can go to one visit and then they'll be billed multiple times just for that one visit. So that's completely different as well.
Just to explain why, another reason, we have a client who came to get direct primary care for his employees. They have another office out in Minnesota, and they bought regular insurance for their employees, but they also got direct primary care memberships for their employees, and said that it saved them so much money on their regular insurance, and also their patients were able to get to a doctor when they needed it instead of having to wait 2 or 3 weeks or months before they could get in. Our people with insurance who also have a direct primary care membership, are they saving money?
Oh yeah, they really are. Again, kind of like you said, with discounts on, labs or blood work, even with prescriptions, you're not having to pay the retail cost that you would with most healthcare insurances. Even if you have like a good RX card, it's still more cost effective to get those lower discounted rates with the membership if you have direct primary care. And again, they work in conjunction with each other. So you might use, your health insurance if you were admitted to the hospital, and that covers there, but you have preventative work or you might need counseling, and then you might use your direct primary care there. So we don't want people to think you have to drop your health insurance to participate, but it also works together and gives you the savings where it needs to.
Just to share, I have one patient who has insurance who was asked about this, and she said, I just like being able to get in when I need to be seen, and I like the doctor.
Yes.
So I'm gonna get a sprained arm from patting myself on the back. Do you have anything further to tell us about insurance?
So again, it's just really about, understanding how your healthcare plan works, the savings that you can get if you are, wanting to look into direct primary care. It's all about that education, and it's all word of mouth, so it's not just something readily available. So if it is more information that you would like, just reach out to Garcia Family Medicine and we can tell you more.
Well, thank you so much, Jalisa.
Thank you.
And that's this week's version of Tess Talk, and we will be with you again next week.